Welcome to this session on newborn reflexes and safety measures. Hi, everyone. Today, we're diving into an amazing topic, the reflexes of newborns and the measures we take to keep them safe. As you care for a newborn, understanding these reflexes and safety protocols is essential for providing the best care. Let's explore each reflex and safety step in detail with some real-life applications and tips. Eye reflexes in newborns. Newborns are born with fascinating reflexes that show us how their nervous system is developing. Let's explore these one by one. 1. Sucking and rooting reflex. How to test. Gently touch the newborn's lip, cheek, or corner of their mouth with a nipple or finger. Response. The newborn turns their head toward the stimulus, opens their mouth, and starts sucking. Purpose. This helps the baby latch onto the mother's breast or a bottle for feeding. Duration. Typically disappears by 3 to 4 months but might persist up to 1 year. Tip: encourage parents to use this reflex to initiate breastfeeding. 2. Swallowing reflex. What happens? After the baby starts sucking and receives fluids, the swallowing reflex kicks in. Coordination. Newborns can swallow without gagging, coughing, or vomiting, a sign of a healthy feeding pattern. Teaching point. If swallowing appears uncoordinated, consult a healthcare provider to rule out feeding difficulties. 3. Tonic neck reflex, fencing reflex. How to test. Gently turn the baby's head to one side while they're lying down. Response. The arm and leg on the side the baby is facing will extend, while the opposite arm and leg flex. Significance. This reflex supports future motor skills and balance development. Duration. Fades away by 3 to 4 months. Demonstration idea. Use a doll to demonstrate this reflex during your teaching session. #4. Palmar and plantar grasp reflexes. How to test. Place your finger in the baby's palm or at the base of their toes. Response. The baby's fingers curl tightly around your finger and their toes curl downward. Duration. Palmar reflex fades within 3 to 4 months. Plantar reflex fades within 8 months. Fun fact, parents often find this reflex endearing as it feels like the baby is holding on to them tightly. 5. Moro reflex, startle reflex. How to test. Hold the baby in a semi-sitting position and let their head and trunk fall backward slightly. Response. The baby's arms extend outward, their thumbs form a C, and then they return to an embrace position. Duration, present at birth and disappears by 6 months. Warning, a persistent Moro reflex after 6 months could indicate neurological issues. 6. Babinski reflex. How to test. Stroke the sole of the foot from the heel to the toes. Response. Toes fan out and the big toe dorsiflexes. Duration. Disappears by 1 year. Clinical note: if absent, it may indicate neurological concerns. 7. Stepping reflex. How to test. Hold the baby upright with their feet touching a surface. Response. The baby alternates flexing and extending their legs as if walking. Duration. Disappears within 3 to 4 months. Newborn safety. Now that we've covered reflexes, let's switch gears and talk about how we keep newborns safe. A. Newborn identification. Identification bracelets. Immediately after birth, bracelets are applied to both the birthing parent and the newborn. These include crucial details like name, sex, date, and time of birth. Technology. Some hospitals use radio frequency transmitters that trigger alarms if the baby is moved outside designated areas. Tip: encourage parents to double-check these bracelets every time they're reunited with their baby. B. Preventing newborn abduction. Parental education. Teach parents to verify the identification of anyone handling their baby. Look for proper photo IDs and security badges. Hospital security. Many hospitals use closed-circuit cameras, code alert bands, and computer monitoring systems to ensure safety. Real-life scenario. Share a success story of how hospital security systems prevented an abduction attempt to emphasize their importance. Conclusion. Understanding newborn reflexes and safety protocols is more than just knowledge. It's a way to ensure that each baby starts their life with the best care possible. Encourage parents to appreciate these reflexes and stay vigilant about safety measures. Remember, a well-informed caregiver is the best protector a newborn can have. Call to action. If you found this session helpful, be sure to share this knowledge with fellow caregivers and parents. Let's create a safe and nurturing environment for our little ones.